Hey nurses, I'm Natasha, your care management nursepreneur. I'm a registered nurse, care management consultant, and I help nurses and primary care practices understand and implement CMS aligned care management models that actually improve patient health outcomes. I want to talk about something that surprises a lot of nurses. You can partner with primary care practices without being employed by them. Most nurses assume that if you're going to work with a practice, you have to be hired as a staff. But that's not the only way to work in primary care. And in many cases, it's not the best one. So today, I want to explain how nurses partner with primary care practices independently, why practices actually need this type of support, how it works, and how these partnerships are typically. Why primary care practices need nurses but can't always hire them. Primary care practices are under a lot of pressure right now. They're managing growing patient panels, increasing number of patients with multiple chronic health conditions, value-based care expectations, limited time during office visits, and ongoing staff shortages. Many practices know they need nursing support to manage patients between visits, but hiring a full-time nurse isn't always feasible. Budget constraints, space limitations, and staffing complexity make traditional hiring difficult. That's where independent nurse partnerships come in. In these models, nurses are not W 2 employees of the practice. Instead, nurses partner with practices to deliver specific services, most often chronic care management, which can be provided remotely under general supervision. General supervision means the provider does not have to be physically present for the nurse to deliver the service. Here's how it typically works at a high level. The practice, working with a nurse care manager, identifies eligible patients. These are usually patients with two or more chronic health conditions. The practice bills for the service and maintains the provider patient relationship. The nurse care manager becomes part of the care team and delivers the clinical care management services remotely outside of the office visit. Care managers engage patients between visits, coordinate care, and documents the work provided. The nurse is paid by the practice for the services delivered. This allows the practice to extend its care team without adding full-time staff, and it allows nurses to work independently while staying aligned with primary care workflows. The practice remains responsible for billing the insurance for care management services. This model works because it solves real problems on both sides. For practices, patients receive more consistent support. Providers have clinical backup outside of office visits. Care doesn't stop when the appointment ends. Outcomes improve. Care management programs become sustainable. Nurse care managers can also support the practice during office visits by helping with patient education, follow up on labs, appointment coordination, and reinforcing care plans. For nurses, you work at the top of your license. You're not limited to one employer. You can partner with multiple practices. You can design flexible remote workflows. You build a business instead of just another job. This is not about nurses competing with practices. It's about nurses complementing and supporting them. Care management is often the starting point, but it's not the only option. Some nurse led partnerships expand to include remote patient monitoring, technology supported check ins, patient education and engagement programs. The common thread is this: technology supports the work, but nurses lead it and bring the human aspect to care delivery. Practices don't just need software, they need clinical thinking, consistency, and human connection. That's what nurses bring. These partnerships are typically structured through contracts or service agreements, not employment offers. That doesn't mean things are complicated. It means roles, expectations, and responsibilities are clearly defined. And most importantly, nurses are recognized as professional partners, not just staff. You don't need to understand every detail right now. What matters is knowing that this model exists and it's growing. If you're a nurse watching this and thinking, I didn't know this was an option, that's exactly the point. Many nurses don't realize that their skills are valuable to primary care practices beyond traditional employment roles. Primary care has real pain points. Nurses are the solution, and care management is one of the clearest places where those needs and skills meet.